2, 1.
Good morning, and welcome to this virtual roundtable on supporting the sandwich generation and their intergenerational caregiving responsibilities. Today, we're raising the voices and experiences of the sandwich generation, the many people who are caring both for children and an aging relative. This is complex, financially challenging, emotionally demanding care that is largely unpaid and unacknowledged. For many of us, we assume these caregiving roles without a second thought. When I cared for my own mother in her leukemia battle before she transitioned, it wasn't a question of if or how. In fact, it wasn't a question at all. I wouldn't have been anywhere other than by her side. But that didn't make it any easier. Just because it is so deeply personal does not mean that tremendous sacrifice isn't required. For sandwich givers, they experience both the changing relationship with a parent or caregiver of their own, compounded with the demands of parenthood, and that takes a toll. A CDC study on caregiving during the pandemic found that nearly 60% of sandwich caregivers experience passive suicidal thoughts. We cannot afford to leave our caregivers behind in our recovery efforts and our investments in infrastructure. And our discussion today will further highlight why caregiving is critical infrastructure. We can no longer compartmentalize how we think about care. The caregivers in our communities live dynamic, intersectional lives, and they deserve policy that is responsive to their experiences and their needs. I'm grateful to my colleagues on the House Democratic Task Force on Aging and Families for championing caregivers and creating space for these important conversations. The task force is certainly not alone in this work. Thank you to the Vice Chair of the Democratic Women's Caucus. Thank you to my sister colleagues for co-sponsoring this event. And I thank you all for your leadership and joining me in virtual community to discuss a population of caregivers that are critical to our care economy. And now we will pass it over to, are we going to go to Ms. Parker now, or? Yes, we are. Okay, Ms. Parker, thank you so very much for joining us today. And we would love to hear from you. Thank you.
Yeah, thank you so much for having me. I'm really very honored to be here from the Pew Research Center. And just to give you a quick word about the Pew Research Center, in case you're not familiar with us, we are a nonprofit fact tank. And so we are nonpartisan, non-advocacy, don't take positions on any policy issues. So to the extent that the conversation veers into policy, you'll find that I am very neutral in my comments, but we really believe in providing a foundation of facts that help decision makers like yourselves make these crucial decisions about some of the challenges facing the country today. So I did bring some data from Pew because that's what we're known for. So I'd like to share my screen if I can, so that I can provide you all with some of the actual numbers that'll go into the sort of the facts underpinning some of these key trends that we're experiencing in the country. So the first thing I want to talk about is just sort of in very basic terms, which I'm sure you're all very aware of, the extent to which the country is rapidly aging, sort of where we've been and where we're headed in terms of an aging US. If you look back to 1950, you can see that people younger than the age of 15 there were many more of them proportionally than there were people ages 65 and older. And then if you look at just recently in 2019, you can see that there was only a slightly larger proportion of the population that was younger than 15 versus 65 and older. And then if you look forward to 2050, and these are projections from the Census Bureau, you can see a much different picture emerging. So some 22% of the population in the US will be 65 and older, and only 17% will be younger than 15. So these are sort of abstract numbers. It's a little hard to picture what this might mean for our country, but it obviously has implications for families, for the labor force, and also for the broader economy. Now, the next important trend, which is very relevant for the topic at hand today, and we've been tracking this for some time, is the growing share of young adults who are living with their parents. Now, this trend has been really decades in the making, but it increased significantly during the Great Recession. when many young adults were taking refuge in their parents' homes during what was a very difficult economy for them. But the trend continued even after the Great Recession and through the recovery. So there's something more going on here than just economic hardship. And then we really saw this figure spike last summer when 52% of adults ages 18 to 29 were living with a parent. This was the highest level that we had seen in this country since the Great Depression. So that's just to put it in a historical perspective. We'll be looking at this as soon as there's new data available. I anticipate it probably will have come down a bit from last summer because there were so many things converging last summer with job dislocation, students coming home from college, all kinds of factors. But it's still going to be high, and it's something that's important to keep in mind as we think about the things that the sandwich generation folks are balancing, the different generations that are depending on them. So now thinking of the sandwich generation, these two trends with an aging population and also young adults staying in their parents' homes or moving back home, and also trends in immigration, which I won't talk too much about now, but we can get to if people are interested in that later on. All these things have contributed to a rise in multi-generational living in the US. And in 2019, 20% of Americans in the whole population were living in a multi-generational household. Now, the way that we define that is there's either two or more adult generations in a household, or there are grandparents and grandchildren under the age of 25. So you might hear different definitions of this. But again, we saw this rise during the Great Recession, and then it continued to rise since then. So now we want to talk a little bit about the sandwich generation. So with people living longer and young adults struggling to gain their financial independence, a significant share of adults are sandwiched between these generations. And there are different definitions of this so-called sandwich generation. The way that we define it in our research is if you have a parent 65 and older and a minor child, or you're financially supporting an adult child, you're considered to be in the sandwich generation. And using this definition, we found that among 40 to 59-year-olds, so sort of middle-aged adults, almost half of them were considered in the sandwich generation in 2014. That's the most recent time we've done this analysis. Again, this is something that we want to update in the wake of the pandemic and see how things have changed. If you narrow it just to people who are providing financial support in both directions, so to a minor child or a young adult and also to an aging parent, then you get about 12% of the population that falls into that category. So really sandwiched in terms of financial obligations that they have going both ways. So not a majority, but still a significant share of Americans. Now, our research shows that the type of support that's provided across generations really differs. So financial support tends to flow much more heavily to adult children than to older adults, but the type of support that flows to older adults comes in the form of other types of assistance, like help with errands or medical appointments or housework, that kind of thing. So there's different sort of pressures on this sandwich group in terms of the type of support that they're providing to these multiple generations. And the next slide here looks at some time use data that we've analyzed, and it sort of starts to look at this idea of unpaid care. So this analysis is from 2017, and we found that 12% of parents with children younger than 18 are also regularly caring for an adult. And we looked at how much time that translates into. And first of all, women are more likely to be in this role than men, and that's something that I'll come back to a little bit later. On average, these caregivers are spending over 2.5 hours a day in unpaid care, and they spend less time on average in paid work than their counterparts who aren't in this caregiving role. And so that obviously has economic, financial implications for them and their families as well. Still thinking about caregiving, we did a survey in 2017 looking at the issue of paid family and medical leave in the US. And what we found at that time was that 11% of all US workers said that in the past 2 years, they had had to take time off from work, a significant amount of time, to care for an aging family member. And you can see here, we sort of give you a sense of what types of family members they're caring for. Most were caring for a parent or a spouse or partner. About 1 in 4 say they were caring for a child of some age. And as we know, as you know well, many Americans don't have access to paid family and medical leave through their employer. So this time off often results in significant wage losses for these workers and caregivers. Here again, we see a gender imbalance. So among adults who told us that they took time off, took family leave in the last 2 years to care for an ill family member, we found that women were much more likely than men to say that they had been the primary caregiver in that situation, 65% versus 44% of men. Men are stepping up in this way, but they're more likely to play a supporting role in caregiving than women. And then just finally, I know we want to move on to the next speaker, but just to put this gender imbalance in some perspective, I wanted to share some labor force data with you. You can see here that mothers, even mothers with very young children, are highly likely to be in the labor force. The share rose steadily in the 1980s and 1990s. It's leveled off pretty much since then, but still you can see very high shares. So most women who are facing pressure in terms of providing care across generations are also balancing those demands with their work. So that's a lot. And those are just some of the key trends that I think are relevant for the topic that we're discussing today. So I will stop sharing my screen and happy to discuss any of this later in the Q&A time.
Wonderful, thank you very much. That was exactly what we needed. Thank you for giving us that data that makes more plain exactly just how just the extent of this and how many people are playing these dual roles. Thank you very much, Ms. Parker. Our second panelist is Karen Lindsey Marshall, the Director of Advocacy and Engagement at the National Alliance for Caregiving. Ms. Marshall, the virtual floor is yours.
Thank you, Congresswoman. Good morning, members of the Democratic Caucus Task Force on Aging and Families and the Democratic Women's Caucus. Thank you for inviting me to participate in this vital discussion on reimagining the care economy to support the sandwich generation and their intergenerational caregiving responsibilities. Our mission at the National Alliance for Caregiving is to build partnerships in research, advocacy, and innovation to make life better for family caregivers. Our work aims to support a society which values, supports, and empowers family caregivers to thrive at home, at work, and in life. And this includes the more than 11 million Americans who comprise 28% of all caregivers and who are caught between the demands of childcare and caring for an adult family member. According to pre-pandemic data that we published 4 months before declaration of the COVID-19 emergency, these caregivers are not only sandwiched between caring for multiple generations, but they're also squeezed by the pressures of balancing their caregiving responsibilities with their work responsibilities. They often feel forced to choose between providing the care their families need and earning the paycheck their families also need. Indeed, some of these caregivers, many of them women, are even squeezed out of the workforce altogether so that they can provide care for their families. In the words of one sandwich caregiver, she actually felt more like a panini. Sandwich generation caregivers provide care an average of 22 hours per week to an adult in addition to childcare, and they often report difficulty finding affordable services to help them provide this care. 1 in 5 reported feeling financial strain as a result of caregiving, and roughly a third also report a high level of emotional stress, with nearly half wanting more help or information about managing that stress. We know that the COVID-19 pandemic has amplified the challenges family caregivers faced prior to the pandemic, but over the course of the pandemic, we've watched these caregivers continue to fill gaps in care, but with access to fewer supports and fewer services. On top of the ongoing shortage of direct care workers that existed before COVID-19, pandemic-related loss of child and adult daycare services has required many sandwich generation caregivers to take on added responsibilities of remote learning and providing even greater complexity of care to the older adults they're caring for, and again, leaving the workforce altogether in some cases to provide care. The pandemic's repercussions on the communities that have been most impacted by its health and economic disparities could affect these communities' ability to provide care for generations to come. Congress passed needed COVID-related legislation that provided some workplace protections to certain family caregivers. But in order to build back better after the pandemic, family caregivers, including sandwich generation caregivers, need policies that protect their financial well-being, including benefits that will help them balance work and caregiving. Specifically, they need a permanent paid family and medical leave policy that is inclusive of all family caregivers across the lifespan. Congress can also alleviate challenges facing sandwich generation caregivers who struggle to balance care and work by strengthening the direct care workforce with creation of new and better jobs, and also expanding access to home and community-based services. These robust policies would augment the care provided across the lifespan, not only by today's sandwich caregivers, but also by the future generations of caregivers who will need to balance work and care down the road. Again, thank you for the opportunity to participate today on behalf of the millions of caregivers who form the backbone of our long-term services and support system.
No, thank you. Thank you so very much. And next we'll hear from one of my constituents, Janelle Patterson. She resides in Dorchester in the Massachusetts 7th Congressional District, and she's a full-time operating room assistant. And she currently provides care for her mother, along with her 16-year-old twin daughters. Janelle, I'm grateful that you could be with us today. It's not often that you have any time to do anything other than what I just spoke to. So I appreciate your making the time to be with us today. So please do share with us your experiences and what it has been like caring for your mother as well as your girls.
Hi, good morning, everyone. Can everybody hear me okay? So yes, I am an operating room assistant at the Brigham Women's Hospital, and my girls just turned 16. So far, my mother was diagnosed maybe going on 4 years now with dementia. So our life just turned real quickly. So my daily challenges is like making sure I split my time between work, my mother, the girls, and how it has really changed for me is that there's so much to do. It's like, you go to work 40 hours a week, 10-hour days. When I leave work, I have to go home. Even though the CNAs are there, I still have to make sure that she's getting the proper care that she needs at the end of the day. So I try to make sure I'm there. I make sure, get her to bed, make sure her meds are put out correctly, make sure she had dinner, find out how her day went, any changes. And this is day to day. Some afternoons I have to leave work, get her groceries. Some afternoons we have to go pick up medication. And sometimes I wonder really how do we get it done, but we manage. And like I said, our lives really has changed because it's like, I made a promise to my mom when she first found out that she was sick, that I promised her that I will take care of her and make sure that, we make sure she gets everything that she needs. My girls are very well involved also because, their grandmother helped me out a lot in taking care of them. So they're very hands-on. So like if I'm at work and something happens urgently, luckily we live down the street and around the corner, they can get to her a lot quicker sometimes than I can. For me, sometimes I wish there was a little more support system out there for us. Like sometimes I don't know, what channels or who to reach out to. Like sometimes I wish there was like an advocate more so that we can get direct contact with when I have like urgent questions or something changes, because like with dementia, her behaviors sometimes change so rapidly, like you don't really know, what to do or, who to ask questions to. The CNAs, I wish sometimes that, when we get them, like, I don't know if there's a way that they can like training for them could be a little better, because sometimes like I find like if we can get CNAs that are a little more like sympathetic or a little more empathy at the needs my mother needs at home, you know, like for instance, like I know sometimes the care can be difficult because sometimes when they're in their own world, it's hard to reach out to them to get them to follow what you might need them to do. So sometimes I wonder if there's a support group like to sit and have these conversations with of what I can do to help her caretakers work better with her. You know, sometimes that's stressful for me to be at work sometimes, and I'm getting phone calls saying that, you know, they can't get her to eat, or simple tasks as getting her from, let's say, from the bed to the wheelchair. So in situations like this, sometimes I have to leave work now to go home to make sure these things are getting done, because if they can't get her out of bed, that means she's not getting cleaned up for the day, or she's not getting her meds, or she's not eating. And, you know, you don't want to see your parents suffer like that, you know. So sometimes I wish there was a little more like places to turn to get these questions answered, like, you know, like a support group that we can get to. So basically that's it for me. It has been very life-changing for the last few years.
Well, Janelle, your mother and your daughters are very fortunate to have you. Thank you for being a fierce advocate and caregiver. And thank you for sharing your story. I know that it has had an impact on my colleagues, and they'll carry that with them.
Yeah.
So we appreciate you very much.
And thank you for inviting me.
And now I want to yield to my longtime friend, and well, I'm a sophomore now, so I can't say my new colleague, but my colleague and my accomplice in good and co-chair of the Task Force on Aging and Families, Congresswoman Schakowsky. I think you're on mute, Jan.
Oh, sorry. Okay.
Okay, we got you.
There we go. Thank you, Congresswoman Presley. Thank you so much for spearheading this event, the Task Force on Aging and Families, and the Democratic Women's Caucus. I want to thank Lois Frankel for stepping in at the last minute to make sure that we are covered here. This is an important coalition, the two organizations, because you can't really separate the caregiving from women's issue. You know, we have called, as the Women's Caucus has called the recession a she session, because it has really affected women so much more. And there's a sociologist that I like to quote who said, many countries have a safety net. The United States has women. And I think that is sad but true, that we, and that's what we're really talking about today, the burdens and of course the joy in some ways of caregiving, but the lack of support. And so I just want to say that both of our organizations, the Women's Caucus and the Task Force on Aging and Families, is going to be working to make sure that we pass legislation, including the Better Care, Better Jobs Act. That's $400 billion that is going to go to home and community-based care. Yes, you're absolutely right. We need to have more individual help for home and family-based caregivers. And we are determined that we're going to work on those issues. And so I want to thank so many people are involved in making this happen. And I know that the Speaker of the House is looking at how when we build back better, we build back better with women. And caregiving is a huge part of this. I want to thank particularly Ms. Patterson. I love our experts who gave us the basis and the facts about it, but telling her own story about what is happening. So I just want to thank you so much for participating. All of our panelists have done a great job, and I yield back my time to Congresswoman Presley. Thank you.
Thank you, Thank you, Congresswoman Schakowsky. And, that was so an accurate characterization. I had not heard that before, but I appreciate your framing there that many countries have safety nets, but here in the US, we have women. I will certainly be using that again and quoting you. And speaking of the women that we have extraordinary ones in this Congress and who co-chair a women's caucus. And I'll echo the sentiments of Congresswoman Schakowsky, Congresswoman Frankel. So much is going on in your home state, and we thank you for your nimbleness and reworking your schedule to join us today, and would love to hear from you. Congresswoman Lois Frankel.
Well, thank you very much. And everybody who's been on here today, Janelle, I really thank you for sharing your story, and Kim and Karen for giving this information. And especially a shout out, for first of all, to all our co-chairs of the task force. And I see Susan Bonamici's on here today. Hello, Doris. Who else popped in here today? I think Jan was here for a minute. Listen, you know what? I feel like I live in right now, I call it a delicious sandwich, because I have an aging mother. She's almost 96 years old, who lives in the same building where I live. And she's pretty independent she can't get around by herself, but other than that, she can tend to her daily needs. But this pandemic really made me realize how much she really did need help. And I have been in that role. And I also have these little two beautiful baby grandchildren who I babysit for all. But the reason I bring this up is because as sometimes you can step back from life and just observe things that maybe you should have known your whole life. But as I see all the care that is and what is necessary to raise these two little grandchildren, I realize that is the kind of care that my mother gave me. And even to this day, she mothers me. And it just really, what it inspires me to understand how much I owe her and how much we owe our older generations to give back the care. So I want to thank all of you for being involved in this mission, not only to make sure we have home care more accessible to a working and middle class and people, but also to raise the wages of the caregivers who are the backbone of the care economy, and many of them have to actually even be on food stamps because we don't pay them enough. And I know that our Women's Caucus is on a mission to make sure when we pass these new Build Back Better packages, one will be what they call the traditional infrastructure, but we are on a mission to make sure that along with that will be a package that will include care, home care, accessible home care for Americans, as well as raising the wages of the caregivers. And I thank you all for being on this mission with us. I yield back, Chair Presley, and you don't have to come to me again. I just thank you all for being here.
Thank you so much, Congresswoman Frankel, for your advocacy and for sharing your own experiences there. And of course, simply because we're members of Congress, we don't stop playing these roles in our own families and in community. And so that, of course, is the impact of having that diverse representation around policymaking tables to make sure that we're lifting those things up each and every day. Now I will turn over the virtual floor to our co-chair, Congresswoman Matsui, for the Task Force on Aging and Families.
Thank you very much. And this has been absolutely wonderful. I guess I get unmuted.
You had it right. Go back. Go back. Unmute. Doris, you're muted. Go back.
I got it.
There you go.
Thank you very much. This has been such a wonderful discussion, and I agree with everything that's been said before. Jan and I are co-chairs of the Task Force on Families and Aging, and this has been so remarkable, and we're all very active in a Democratic Women's Caucus. And having the groups together have become tremendous because we all believe that families are critical. Women are, as Jan said, somewhat always a safety net. And as we listen, particularly, Janelle, what sharing your experience has been something that is heartwarming and heartbreaking at the same time. We all understand what it is to love our kids and love our parents, and being caught in the middle and trying to do both at the same time. So as a Women's Caucus and a Task Force on Families, we're trying to get engaged in this in a way in which we really do effectively move along so we can really help the families and the women that we all love and care for. You know, I was picking up on what Janelle said. Home and community-based services are critical for reducing institutional care and related costs. And I'm thinking now here about Alzheimer's disease and dementia. As many of you know, Democrats have been working on legislation that carries forward President Biden's bold vision to expand access to high quality caregiving. And I want to bring Ms. Marshall in this as a question. We heard from Janelle, we heard many stories like that. And what further steps should Congress consider to ensure that home and community-based services are dementia capable and effectively serving individuals and family caregivers dealing with dementia? This is an all-around type of concern and problem. As particularly as you look at the family situation, a lot of women are delaying their childbearing, so they have smaller kids, and then they have older parents at the same time. So we really need to be much more engaged in the dementia aspect of this. Ms. Marshall?
Thank you for the question, first of all. And actually, it raises, it really resonates with me personally. Janelle's story about her children, her daughters helping her care for her mother reminds me of me with my mother. I helped my mother care for my grandmother when she had cognitive decline as a teenager and had to move into our home. And this was more years than I care to say, but a few decades ago. And we actually encountered the same issues with direct care workers not necessarily being equipped to deal and to be able to respond to behaviors associated with cognitive decline. In addition, I'll also note that my father was diagnosed with dementia a few years after he and I both cared for my mother, who had stomach cancer before she died. And I ended up actually spending when my peers were building families, I was actually caregiving. So again, that resonates with me, the idea that people who are caregiving aren't necessarily going to have anyone to care for them as they get older, which is why brain health is so important. So I think that educating, first of all, communities about brain health is very important. I know when my grandmother had cognitive decline, one of the obstacles in her receiving skilled care from paid workers was that she didn't have a diagnosis. It was just considered she was getting old and, as we said, senile, and it wasn't associated with brain health. So I think that educating communities, first of all, about brain health and what cognitive decline looks like as a first step towards equipping the entire community to help provide better care.
Thank you.
Thank you, and thank you for that question, Chair Matsui, and thank you, Ms. Marshall, for that comprehensive response. I was thinking about how there are so many ways in which our young people have been adultified, given so many things we're facing as a country. There's a wisdom that they carry that comes from hardship, and it's becoming increasingly more challenging to defend their childhood. Even though we know that they find great honor in supporting their families. So I wanted to, before we formally transition into more Q&A, make sure that I give my other sister colleague here, Congresswoman Bonamici, who's graciously joined us today to listen to all of our experts, and wanted to afford her the opportunity to say a few words and to transition us into Q&A if you have a question.
Thank you so much, Vice Chair Presley, and thank you to the other members of Congress and the experts, but really thank you so much to Janelle for sharing your story. These stories really do make a difference, and I think your example, as well as the others we've heard today, really send a message that we need long-term structural solutions. And I myself have a story. My stepfather was caring for my mother who had dementia. He was diagnosed with cancer, and 3 months later was gone. And then the responsibility was mine, which I accepted wholeheartedly, but the challenges, and I don't have young children, I have adult children. It really was enlightening to me to see some of the same issues that Janelle brought up about the caregivers. I mean, we're fortunate because we had the resources, and my mother did own, and stepfather did own a home, so we had resources. But even with resources, it's challenging. The caregivers, of course, working hard every day, but not being paid well. And there's a lot of turnover, and many of them did not have, as my mother's dementia turned into Alzheimer's. We were looking for different levels of care, and it's hard. You have to have time to do the research and to visit places and to try to figure out what's the right decision. But I think my point is that these things take a long time. We need this structural change that not only will result in caregivers who are really compensated for the value of what they're doing, but also the understanding that we can't have work policies that say, okay, well, you can have a couple months off, or even 6 months of paid leave, because these challenges can continue, or responsibilities, not always challenges, but responsibilities can continue for years. So we need to have a system that has this support there. And as somebody who works on affordable, accessible childcare as well as senior care, I understand and talk about the sandwich generation a lot. And Janelle, you are really living it, and thank you so much for sharing your personal story. And when you talked about how your daughters help, I saw with my own children, they had the opportunity to help with my mom, their grandmother. It really caused some wonderful growth, and helped them as become responsible people. But yours are 16. It's important for them to see those lessons, but to still have the teenage years to enjoy. So thank you for sharing your challenges. I wanted to ask Ms. Parker. I mentioned my situation, and I was fortunate. My mom passed a year ago, but we were able to have care for her and to find care, even though we had challenges along the way. We know that the gaps in care disproportionately affect low-income families, and I know that was true before the pandemic. Could you talk a little bit about how the pandemic has, as with childcare, has exacerbated the need for care, that reliable care that is affordable, but that is also caregivers who are compensated appropriately for the value of the work they do. So thank you so much. Thank you for inviting me to this really important conversation. I look forward to your responses.
Sure. In terms of the pandemic and the impact that it had on workers, I know I don't have data particularly on people's caregiving needs during the pandemic. We weren't able to ask specifically about that. We do know that there was an incredible burden placed on working parents when their children were back in the home unexpectedly and for a sustained period of time as childcare centers and schools closed down. So that was obviously a significant adjustment, forced many women out of the labor force, and many men pulled out of the labor force as well, trying to deal with this unexpected situation that they found themselves in. But we do know in terms of the job losses that occurred during the pandemic, they were disproportionately to low-wage workers. So those workers who already, many of whom had these caregiving responsibilities within their families, lost their jobs, didn't have a lot of savings, were having to turn to, borrowing from family members or friends, or cutting back significantly on spending, or doubling up in housing, just in order to keep to survive themselves, and then to imagine the caregiving responsibilities that they have on top of this. It's obviously was a huge burden for them. One sort of hopeful sign that I wanted to point out related to the pandemic is that we know for workers who had the opportunity to transition to telework, that while they had their children in the home, that was very difficult. But as workers are things are getting back to normal, kids are going back to school, daycares are reopening, workers are returning to work, but many of them will continue to have a teleworking option. And what they have found, according to our surveys, is a lot more flexibility in terms of deciding when to work the hours that they need to work. So it's not necessarily that they want to work fewer hours, but they want to fit it in with all of these other pressures, including caregiving responsibilities that they have in their lives. And now they sort of have that. And I think that's one positive thing to come out of the pandemic, is this sort of genie is out of the bottle now. People who can do their jobs from home are going to be able to have that flexibility that they've always wanted. And in our surveys in the past, even before the pandemic, we found what workers wanted most of all was flexibility, more control, just to balance all of the challenges that they had. But I have to point out that the majority of US workers do not have jobs that are teleworkable. And people like Janelle, who are doing such crucial work, they have to do that work in person. I mean, you've got to be there in the hospital working. So for them, the flexibility, is not going to be a byproduct of this pandemic. And that's something that we really need to think about going forward, because they too need flexibility.
Thank you. I appreciate that. And I just want to give a shout out to the frontline workers who have been out there working, and how challenging that has been during the pandemic, if they're also going home to take care of children or adults. And I had heard about families that were moving their loved ones out of long-term care facilities during COVID because they were so concerned about the rates of infection in long-term care facilities, and just taking on an additional responsibility. So it's been a really challenging time, and thanks to everybody out there working on these important issues. I yield back to the Vice Chair. Thank you.
Thank you, Congresswoman Bonamici. Now I will yield to the Democratic Women's Caucus Co-Chair, Congresswoman Frankel, for a question.
Hello, thank you. Ayanna, thank you for leading this today. And again, thank all of you for joining us. Here's my question. If you could wave a magic wand, or let's say we put you in charge of the United States Congress for a day, what would be the most important steps you would like to see Congress take in order to help with the situation you've been talking about? Come on, this is your big chance.
I can jump in. Thank you for the question, Congresswoman. Improving the system of long-term services and supports is so crucial to family caregivers. So many family caregivers have had to actually leave the workforce during COVID because the direct care workers helping their families had to leave their jobs to take care of their families. So lifting asset requirements as qualifiers for Medicaid eligibility so that people don't have such long wait lists would go a long way towards getting the home care workers that we talked about into homes, documenting and educating caregivers at discharge so that they can understand the care that their loved ones will need regardless of the conditions of their loved ones. Creating a national strategy that retains direct care workers and increases wages for them and gives them access to additional training so that they can provide more support to these families. And also just expanding the definition of families to include individuals that people have the caregiver has a close relationship with is the equivalent of a familial relationship, such as a child, a parent, a domestic partner, a sibling, a grandchild, giving more Americans access to the long-term services and supports, affordable long-term services and supports that can help them continue to take care of their loved ones in all of the ways that they do, from activities, from daily living to bringing in income to support their families.
Thank you very much. Anyone else?
I can just add to that. I cannot advocate for particular policies. It just wouldn't be appropriate in my role as a researcher at Pew. But I would say that in the study that we did on paid family and medical leave, which I mentioned earlier, seeing the inequities in the way that our system is set up now and the burden that falls on lower income workers when they do have to take leave. In our survey, we found 62% of workers earning less than $30,000 a year had no pay during the time that they took paid family and medical leave. And it's a much smaller share among higher wage workers. So it's very inequitable, and there's no uniformity to the sort of piecemeal system that we have now, with benefits coming from employers and many people shut out from those benefits. So that's just something to highlight in terms of experiences of Americans.
Thank you very much. Janelle, what can we do for you?
I guess, as everybody's just saying, for me, it's more of the support system, and also I agree with when it comes to work and you have to take time off, if they can make it a little more doable, a little more easier, because it's really like jumping hoops, especially when you're working like in facilities like hospitals and such. So I would have to agree with what everybody just said. It's a support system and work for me.
Thank you so much. And again, thank you. Yield back to our Vice Chair Presley.
Thank you, Congresswoman Frankel. And, we don't have a magic wand, but we do have the power of the pen and a robust bully pulpit here. And I know that we'll be stewarding and using both. I had a couple of questions. First, I'll just begin. I promise I'm showing no bias to my constituent, Ms. Patterson, but because her lived experience day to day is the expertise that we need to learn from. When you talk about I'd like to know, in terms of services that you have been able to access that have been supportive, what are those? Because very often we're just focused on what isn't working, and then we miss the opportunity to preserve, to scale up, and to invest more in what is working. So when it comes to accessing services that have been helpful to you, what do those look like? How have you accessed them?
Well, for us, the services that I do have, my mom, she has CNA care, and we have care coming in all week, and they come from 7 in the morning till 7 in the afternoon, which works out pretty good. The only thing that I find as dissatisfying at times is the fact that, like, if the CNA calls out like at the last minute, then they don't have like a backup plan. Like, there's nobody in place to say, okay, well, Janelle can't make it into work today, let me send such and such. So what happens then is that, then I get called. So that either means I have to leave work, because I come to work for 6. So that either means I have to leave work to go take care of mom until they find somebody to come in. So I do have CNA care, which I do appreciate. We also have
community help, as you've needed, there's just so many wraparound supports that there's a need. Maybe that's lacking. You have a need, but you haven't been able to access that. I was just curious, when it comes to community support, if there's anything that has been able to better help you.
Community support. We're not really at I want to say we're not really like I can't really think at the top of my head that stuff that we like need. Like, as of right now, I think what I need, I'm kind of okay, so to say,
Okay.
Yeah.
So just go back to your original statement then, just in terms of more training?
Yeah, more training, definitely. That I have to agree with 100%. Like, yeah.
Competency
Yeah.
and a bigger bench there so that when things come up, there is a contingency plan.
You're right.
Okay.
Yeah.
Okay.
Just things like that. Yes.
All right. And Ms. Marshall, I shared in my opening remarks, and I'd love to hear from Ms. Parker as well, if you'd like to weigh in on this. Having been a caregiver, I was not necessarily surprised by how many caregivers do struggle with passive suicidal thoughts. Although there's no place else in the world you'd rather be than there with your loved one. Again, it does take a toll and can be incredibly isolating. But could you just expound or further on for these sandwich caregivers here, what is the unique toll that might be taken on them when it comes to their mental health and well-being, and how are we missing this, and how do we offer real support there?
Thank you, Congresswoman Presley. To be a family caregiver, especially a sandwich generation caregiver, means that you want to do all of the things all of the time for your family. And if you're a family caregiver, you often have to navigate many siloed systems of services and supports to help your loved ones. And that can become extremely frustrating. And at the same time, you're dealing with the reality of your loved one's health failing, perhaps the end of their life approaching. And it's a very frustrating experience, and it can be very overwhelming, and it's very hard to stay healthy and to take care of yourself and your own mental and physical health while you're putting so much effort into caring for your loved ones. Family caregivers need access to services and supports that help them receive the support that they need. Mental health services that last the duration of their care journeys, because caregivers have no idea necessarily how long they'll be caregivers. Nobody really plans to be a caregiver, and when it happens, they just want it to be over because they want their loved one to get better. But obviously, conditions can go on for many years, sometimes decades, and that can take its toll. It's also important that once caregivers cease being caregivers, they have access to mental health supports, because there can be lasting trauma from the experience. And oftentimes, once a caregiver, you end up being a serial caregiver and caring for others in your family, especially if you're talking about a sandwich generation caregiver. The likelihood of them becoming a caregiver once again for someone with a chronic illness after losing a loved one is a little bit higher, because again, they're caring for multiple people. So making sure that there are those structures in place to help caregivers maintain their own health and to identify their role, and to recognize that even though they may not see a formal role for themselves in the healthcare system, they are important members of the healthcare team, creating more pathways so that caregivers can receive referrals from physicians, particularly with physicians that are caring for the loved ones that they're bringing to medical appointments, for instance, pathways so that physicians can refer them to services once they find out that they're caregivers, working with public health departments also to help refer caregivers wherever they interact with systems. And on behalf of the family that they're taking care of, we should set up entry points for them to access the services that they need to stay healthy, because caregiving truly is a public health issue.
Absolutely. Thank you for saying that at every access point, because I think very often we place the onus solely on the person to self-select. But if at every access point, those opportunities are to access services are there, trained professionals, hopefully can spot those indicators of someone who's in distress. If they don't have the wherewithal and the self-agency in that moment to say, I'm overwhelmed and I need help. I know we're coming towards the end here, but Ms. Parker, was there anything that you wanted to add to that in terms of the mental health challenges for our sandwich generation caregivers?
Sure, I'll just add really briefly. I don't have data on mental health or well-being specifically, but we do know, looking at the amount of time that goes into caring for if you're a multi-generational caregiver, you're spending multiple hours with additional care responsibilities that other people don't have. So that time has to come from somewhere. And it means less time for sleep, less time for leisure, and less time for paid work. And that last one has implications for long-term financial security and also for career advancement. So I can see how all of those things combined could definitely have a negative effect on someone's mental health and well-being.
Thank you, Ms. Parker. Ms. Patterson, is there anything else that you would like to share with us as we begin to round out and the close of the briefing here today?
No, thank you. But I would like to say thank you for having me. I appreciate it so much for getting my voice out there. I really appreciate it.
Thank you. Thank you for making the time. We'll be in touch, okay?
Okay. Thank you so much.
Well, thank you everyone for participating in this briefing today. We thank all of our experts, including those who are a part of this generation and are playing the role of caregiver every day, like Ms. Patterson. This discussion has certainly highlighted the fact that when we prioritize our care economy, that I believe we're also prioritizing racial, economic, and gender justice. And of course, we have seen our minoritized Black and Brown communities, and particularly women of color, have been hardest hit by the pandemic, and they will recover the slowest, or they won't recover at all, unless we are pursuing bold legislative solutions that are as intersectional as the lived experiences of the people that we represent. So once again, I thank all of my colleagues for their participation today. Thank you for your commitment to a just and equitable post-pandemic recovery. Thank you to all of my counterparts on the Task Force on Aging and Families, the Democratic Women's Caucus, and again, our amazing panelists for engaging in this roundtable. I look forward to continuing this conversation and working with all of you to support our care economy and our caregivers.